welcome back to another episode of MedSynapse podcast series, where we decode clinical complexities with leading minds in medicine. I'm your host, Hetvisha, and today we are diving into a topic that remains both cosmetically distressing and therapeutically frustrating, which is melasma. Despite decades of research, why do we keep seeing relapses? And why does it persist, especially in darker skin types? And to dissect this, I am joined by Dr. Gurman Singh Bhasin, an MD dermatologist with deep expertise in clinical and aesthetic dermatology, advanced laser procedures, and teleconsultation services. With multiple fellowships and a passion for innovation, he is redefining patient centric care in pigmentary disorders. So, Dr. Gurman, welcome to the show, and it's such a pleasure to have a talk with you today.
Thank you so much, Hethi, for this wonderful introduction. I guess it's likewise. I like to hear, and I'm happy that I'm here to share, talk about a topic that is, as complex as it is. I feel for treatment for us professionals, it is something that even we feel that we are sharing a lifelong journey with the patients. So yeah.
Definitely, yes, I truly agree with it. So, Doctor, to start with, melasma is often misunderstood, even within clinical practice. So, could you start by breaking down the most common clinical myths around melasma's etiology that may be, impacting long-term treatment outcomes?
Right. See, most first and foremost, what patients think, and even certain professionals do, that melasma is just a pigmentary or an epidermal, that is the topmost layer of the skin problem. It's actually not. It goes very much deep into the dermis, it goes into the basement membrane. There is inflammation, there are vessels involved. So there is vascular involvement, vessels involvement, inflammation, and it's not just about the skin. It is multifactorial. It has involvement of hormones, genetics, environment, photo exposure, most important. Photo exposure, any kind of light is what causes melasma or triggers it or worsens it. And most important, this also is a myth. What people are and what, not from our fraternity, people from other fraternity are sharing is that it is curable. This is a hard fact that I tell my patient of melasma who comes to me that, sir or ma'am, I am sorry. I will try my 100%, but this will not be something that will be like completely gone. You will have to maintain it. You will, like your brush your teeth every day, eat your food every day. You have to maintain your melasma every day. It can be controlled, it can be concealed, but it cannot vanish permanently. So this is what I would like to clear.
I think that's such an important thing, and that clarity is so much needed, I feel. So now, Doctor, in your experience, what are the key reasons dermatologists struggle with, sustained remission, particularly in darker skin types? And are we actually potentially missing a deeper pathophysiological component here?
Yeah, see, with the darker skin types, so we have Fitzpatrick scaling. We call them 4 to 6. Melasma becomes tougher because there is more of melanin. Melasma is what increases melanin. So there is more of basal melanin already in darker skin types. Then these skin types are the ones which have a tendency to give post-inflammatory hyperpigmentation. So that is something that coincides with melasma, and then again, patient is like, oh, I was getting the treatment for melasma, and now you've added my pigmentation to it. So that is something. And most importantly, darker skin types, there's one more concern that patients are trying everything on earth. They are just, they're moving from doctor to doctor. They're just trying everything. So much of trying it worsens the pathophysiology. And definitely certain patients have more melanocyte activity. They have vascular endothelial growth factor driven vascular pathology. There is maybe some subclinical inflammation. And this is more common in darker skin types. So, we have to tackle this, and we have to find their underlying triggers, and then we have to maintain. So, we as dermats are just firefighting when we are treating a patient of melasma in a darker skin type.
Yeah, I think that becomes very difficult for dermats also to treat it sometimes.
It's
And
something
as per
that is
your
very
term.
challenging for us also. Like, even like I was recently in a panel discussion, and there also doctors were like, "Oh my God, melasma patient is someone that I have to hold the hand till the end." But
Yeah,
get better also for sure. They just have to be
sure.
patient about it.
Very patient, yeah. And I think uh, these kind of things also give a lot of comfort to the patients also. And I think sometimes patients also need to know and accept the reality also.
Agreed. Agreed.
So, Doctor, now let's shift to external influencers. So, how do lifestyle factors, hormonal modulation, and photo-aggravation interplay in melasma management? And do you think we are actually underestimating their role during patient counseling?
Definitely. Like, I tell the patients that I am not, if you are not going to maintain your lifestyle, no
Mhm.
amount of creams or no amount of procedures will help you. Hormonal
Absolutely.
triggers, definitely, from females having oral contraceptive pills to females having thyroid dysfunction, it can flare melasma. No,
Right.
the most important fact with which patients, nowadays work from home culture is very common. So patients come and tell me, "Sir, I am sitting at home. Why do I need a sunscreen for that?" But the problem is UV is not only the trigger, even visible light, blue light, infrared light, heat from the cooking in front of gas can lead or aggravate melasma. And UVA and UVB, there are two types of rays. UVB is the burning ray and UVA is the aging ray. So that is getting through your windows also. It does not need just to be open light. So, that is something that is important. And nowadays, most important thing is stress. So stress increases your cortisol's level, and cortisol is a melanogenic hormone. So that is also leading to melasma. So when you tell me that just give me the creams and do the procedures and get me, I don't think it's possible. If you are having exposure of sunlight, if you're not following the lifestyle modifications, then no amount of treatment can help you. So yeah, these
Right.
factors are very important.
Yeah, I think not just medications, but also lifestyle plays a huge,
Yeah,
huge role
it
in
is
this.
very, yeah.
Yeah. So now, doctor, even with access to lasers or tranexamic acid and triple combination relapses rate remain high. So why do you think current evidence-based protocols are failing to ensure long-term control?
See, ma'am, the problem is that patients are, lack of maintenance from patients and they are unrealistic expectations. That's the
Oh,
problem. In the first consultation, only if you counsel the patient that, you have to stick to this for a long period of time. And if that patient does not want to, you're happy to go and visit another doctor because I cannot treat it until unless you have the patience and you have the understanding. So, most important is you have to make sure that the patient knows how to maintain it and does not have unrealistic. I tell the patient, I'm giving you 1 month of treatment. Out of 100%, if 20% is reached, our goal is achieved. If 20% is also there, will be chance that it will not be achieved, but 20% is the max that I tell the patient. And they say that okay, they have triple combination and it goes after a month, it lightens and then again worsens because they have stopped it. You have to taper things down. They don't let us taper only. Okay, lasers also they feel like maybe one sitting will do wonders. It's not like that. So it's and tranexamic acid also has to be given in a pulse way, in a cycled way. We have to give intralesional, oral, and also people don't want to apply. They say that I can't apply sunscreen. My skin feels this, that. There are all kinds of sunscreens available these days. I give oily skin different, dry skin different, but they feel like no, I don't have the time, I have office and all of that. So I feel for my side, I tell the patient melasma is 30% of my treatment but 70% of your discipline. So yeah, I feel no amount of drugs or updates can help if patients don't follow the discipline, and that is where these relapse rates are getting high.
correct, correct. I think that's an insightful perspective, and it also almost feels like, we are chasing short-term
Yeah,
clearance rather than, building long-term skin resilience.
exactly.
So it's very necessary to see it long-term also.
Right.
Uh, So, Dr. Now, with your background in aesthetics and teledermatology, do you see a future for AI-assisted pigmentation tracking or remote monitoring to enhance patient adherence and treatment outcomes?
Definitely. See, I feel if used correctly, AI can make wonders. There are melasma severity scores, and so where we can make it more objective rather than being subjective.
Hmm.
So for me, what is melasma, moderate, mild, or severe, might be mild for you. So these AI can help in objectifying melasma so that we can make treatment protocols that this is the score, this is the treatment that is 100 patients, if we do studies, 100 patients have been given this treatment and 90% have given resolvement to this. So objectively, we know this score, this treatment. So if a doctor wants to see that kind of a patient, they can just search for it, and then you don't need to refer articles. You can just say, okay, this is how it is, and this score, this one is needed. So it becomes very objective. If I am seeing a patient in teledermatology, when I have to send them to a local doctor, I can tell the write it on my prescription that this is the score of melasma. Please, work accordingly, and then they don't have to take the entire history, and the patient does not have to go through the trauma again. So I feel remote follow-ups this way can become better. And also AI mean your devices photo documentation. When we photo document, we have pictures of what are the grades. That's what we do in our clinic also. We take pictures of every serial procedures after the patient, so that even the patient can see the difference, that this is the difference. So that's how all these things can help. But I feel most importantly, the objective part of it will be something, because every thing is subjective, but by doing this we make it objective and then easy maintenance.
Yeah, I think that's such a insightful perspective from that. Like, objective is really necessary,
Yeah,
and that's exciting to hear, as always, about new advancements.
yeah.
So, Dr. Now, before we wrap up, can you share any novel or promising approaches, topical, procedural, or system-based, that you have found effective for relapsing melasma?
Yeah. So there's something nowadays which has come, which I have started giving to my patients, and they are responding well. Not like all of them, but yeah, something new. Oral sunscreens, oral sunscreen
Oh,
is something. So I give mostly to my travel patients. It's not that they don't tan or they don't worsen, but the time taken to come back to benchmark or to at least baseline is lesser. Say, for example, when they are traveling, they cannot do everything in the routine. So
right.
if they are having the oral sunscreen, they might tan, it might worsen a bit, but then it will come back to normal again once. So that period of the time to come back to normal is reduced with the help of oral sunscreen.
Right.
There's some new molecule which I have started using, which is cysteamine. I give it for a short-term application, and it is giving me good results in melasma. Then tranexamic acid obviously is something that has helped us a lot, and it's being used now quite a lot of times. Lasers, definitely low fluence Q switch lasers, micro needling with tranexamic acid. That's what I do in my clinic also. But that requires a couple of sittings. But if you ask me, which is the most effective regime nowadays, I feel what the patient sticks to. Consistency is what
Consistency is key. True, true, true.
even following a basic regime, but the patient is sticking to it. I feel that goes far any new treatment for sure.
Absolutely. It is like the time that takes, and you need to be patient for that.
Agreed.
That's very true. So, Doctor,
Agreed.
as we wrap up today's session, thank you so much for this practical and thought-provoking discussions. And I think you've helped us see melasma not just as a cosmetic concern, but also as a chronic, relapsing pigmentary disorders that demands multidimensional care. So, thank you so much for sharing that.
It was a pleasure speaking with you too.
Same here, Doctor. And to our listeners, thank you for tuning into this episode. And remember, if you're a healthcare professional who's eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay curious and stay compassionate.